Good afternoon, everyone. My name is Grace Ashu. I am the Regional Director of Prevention. I oversee Arizona, Texas, and South Carolina prevention operations. And welcome to the CAN Storyteller Series. We are so excited for you all to be here today to talk about the much needed conversation when it comes to amplifying Black female voices. We have four wonderful storytellers here today to talk about the amazing work that they do in the community and how they support advocacy and opportunities for HIV prevention services and education towards Black women. Before we get started, I wanted to share a little bit more about why we are here today. In most recent findings, the new HIV infections predominantly are specific to Black women, and overall, Black women having 60% of the new HIV diagnoses. However, when it comes to that, Black women only account for 15% of the female population. When you think about that statistic, it's staggering when it comes to the amount of opportunity that Black women have for opportunities for testing opportunities, prevention opportunities, as well as sexual health opportunities. One of the main things that CAN has asked ourselves internally over the past 2 years is how do we continually impact Black and Brown communities, specifically Black women in HIV prevention? This question then created the Community Health Initiative, which is what you see today. With the Community Health Initiative, we have created the project to be able to address the barriers that multiple communities face when it comes to HIV prevention, education, and services. So when we talk about barriers, there's many reasons that lead to high cases of HIV in our Black and Brown communities, such as lack of access to services, stigma, racism, and homophobia. Those are multiple factors that lead into why we see the prevalence in our Black and Brown communities. And CAN wants to do the job of dispelling these narratives to be able to provide more services to our local Black and Brown communities, and also encourage the opportunities that our Black and Brown communities have, not only through testing opportunities, but also through education opportunities. In the past 2 years of implementing the Community Health Initiative, we have seen amazing success with over 20 new partnership opportunities created through engaging with our local Black and Brown organizations throughout the East to West Coast within all of our prevention regions. We've also dedicated a specific amount of total testing opportunities dedicated to our Black and Brown community members, specifically totaling over 15% total testing growth over the past 2 years towards our Black and Brown communities. And that not only extends into our in-clinic services, but that also extends into our outreach services when it comes to engaging our community members where they're at through our mobile testing unit operations. When it comes to our free testing program, where we are able to test community members for HIV, STIs, and hepatitis C. Not only through our testing and outreach modalities are we encouraging the growth and opportunity for our Black and Brown community members, we are also increasing the availability to sponsor and collaborate with our community partners. So we have also made sure that we are investing in our communities of color over these past 2 years. And our Community Health Initiative has grown to what you see today. With the sponsorship through ViiV, we are hosting the CAN Storyteller Series today to engage and amplify the voices of Black female leaders when it comes to Black women in HIV and prevention services. So I am so excited to introduce our panelist of four storytellers that are here to talk about the amazing work they do in the community and also engage in ways that other organizations throughout the different areas are able to engage more with our Black and Brown community members. So without further ado, I would love to welcome our storytellers. They are wonderful panelists ranging from East to West Coast who are here to talk to you a little bit more about the work that they do in the community. So I would love to welcome Miss Alicia McKinley Beach, Miss Sharonda Lynn, Ashley Kaysen, and Kenja Hassan. Thank you so much for joining us today. I'm so excited that you all are here.
Thank you so much for having us.
Of course. And I'll first start with the introductions with Leisha, just giving a general bio and introduction to the work that she does in the community.
Sure. So, good afternoon, everyone. Truly honored to be here. I'm Leisha McKinley Beach, founder and CEO of the Black Public Health Academy. I reside in Atlanta, but I would be in so much trouble if I didn't acknowledge that I am a Florida native, and just so honored to be amongst these amazing sisters.
Thank you, Leisha. Sharonda.
Hi, I am Sharonda Lynn. I'm an HIV advocate. I've been HIV positive for 24 years. I am stationed out of Jacksonville, Florida, native from Dallas, Texas. I am the founder and CEO of Have an Incredible Victory in Jacksonville, Florida. Thank you.
Thank you so much, Sharonda. Kenja.
Hi, I am. Can you hear me okay? I
Yes.
am, thank you, Dr. Kinja Hassan at Arizona State University. My full-time job is with Arizona State University's Office of Government and Community Engagement, but I'm also one of the original committee members to the City of Phoenix Fast Track Cities Ad Hoc Committee. And I have done research and spend my side time engaging in HIV because I'm a native of Washington, D.C. That's still the city of my heart, and that's still a city that's still struggling with HIV. And Phoenix, our Black population in Phoenix is small, but we are mighty, and I'm always ready to amplify the voices of Black Phoenicians.
Amazing. Thank you so much, Kenja. Ashley.
Good afternoon. I'm Ashley Kaysen. I am a program specialist with CAN Community Health. I'm also the founder and CEO of Her Voice LLC. I am a community health advocate and also a person that is living with HIV. I was born HIV positive, so I am considered a lifetime HIV survivor.
Thank you so much, Ashley. And thank you all for being here today. We're so excited for this program. And what we're going to go into next is our focused question session, where we are able to ask specific questions directed to our storytellers today. And we are first going to start with Leisha with the first question in regards to Black women when it comes to the history of HIV. This is a very important topic with just understanding the impacts that Black women have faced over years when it comes to the stigma, the opportunities for lack of access to services when it comes to Black women, and what we see now when it comes to the prevalence of HIV. So, Leisha, our first question is, what is the perception of Black women within the history of HIV?
Thank you for that, Grace. It is extremely important that we first acknowledge that Black women have always been more than just recipients of services. We have been leaders, we have been pioneers, we have been contributors to the HIV epidemic since its existence. It is so unfortunate, though, that when the story gets told about HIV and the contributions and the progress and the forward movement, oftentimes Black women are left out of those conversations. And so, what I want to do in this moment, those of you who are watching on whatever virtual platform that you selected, I want you to type in the chat Black women that are from your state, your jurisdiction, that you want to thank for their contributions to this movement. We don't always get that. And so Grace has given me 30 seconds to be able to say thank you. And so let them know that their service and their work has not gone unnoticed. Grace, there are some women in health departments from years of sacrifice and service. I just want to acknowledge, if you know them, show me that you're giving them all this love that I'm giving with an emoji. Dr. Oni Blackstock, Evelyn Ula, our Marlene McNeese Ward, out of the great state of Louisiana, Miss Jackie Bickham, Jora White, and Sharon Jordan. Oftentimes, our health department women and leaders, they don't get the credit that's due. So I see some women who are taking my pledge right now. They're posting names of sisters from the HIV movement on the screen. Community members, who are some of those? Dazon Dixon, Diallo, Tori Cooper, Nina Smith Bakehead, Pernessa Seal from the Balm in Gilead, Greta Jones, Calinthia Nunnally, Trina Scott, all these women. You may not know all of their names, but I promise you, you have implemented an intervention. You've modeled a Black women's program. You've created something that these women have had their hands on, that they might not have been recognized for the work that they've done. Policymakers, Vanessa Johnson, Tony Young, Daphina Ward. There are some amazing Black women in HIV research. And it didn't just start this year. We go back to how many folks work with the sister intervention, with Dr. Gina Wingood. You know, we don't hear her name referenced a lot. And Dr. Dawn Smith, the mother of PrEP. We may have some questions about PrEP later, but let's not forget that it is a Black woman who gave of her intellect and her service that people all over the world are benefiting from the amazing work of PrEP. And I won't leave this question, Grace, without acknowledging some women that I see as the 2024 leaders. Keep your eye on them, support them, acknowledge them. Miss Rania Copeland, Danielle Campbell. One of those women is on this screen right now. Miss Sharonda Lynn, Camilla Stanley from the DC Health Department. Kenja made reference to DC. There's a great young woman, Black woman in the DC Health Department who is doing her thing. Mandisa Moore O'Neill, CC Coleman, and Lasagna Trailer. I just wanted to take this time to honor my beautiful sisters for the amazing work that they have done. I couldn't do it all. So, y'all, I need you to help me keep honoring, keep putting the women on the screen. Let them feel the love. Let them hear from their colleagues that they might not have got noticed for World AIDS Day. They might not have got noticed for Women and Girls Day, but that you are acknowledging them right now. And that's your way of saying thank you for your service.
Leisha, that was so wonderful. And just honoring the women that have put in the work, especially when it comes to our HIV field, showing up as Black women. We already know that there's so many barriers to care, in particular to Black women and how they advance in this healthcare system. So just knowing a little bit more about ways that the Black women that are these pillars in the community are advancing access to care, advancing services is so wonderful. And a second part to our question is, how have Black women been seen as recipients versus contributors to the history of HIV?
Oftentimes, again, as we're telling the history of the contributors, Black women aren't noticed. They're not recognized. But let's be crystal clear that when we look at the amazing development of HIV prevention, care, and treatment services, we are there. We have been there and will be there until we get to the end of new HIV diagnoses. What a shame it would be to have Black women who have given of themselves and made extreme sacrifices to serve in this movement. And when the time comes to prioritize our needs, to address our care and treatment issues, to scale up prevention services for Black women, that nobody is creating the voice to say center Black women except for Black women. So allies become important for this as well. Don't let us just toot our own horn. Be an ally and talk about and demand and create space for Black women to be uplifted.
Absolutely. And I think that you had such a good point when it comes to allyship and how we create initiatives and projects that center around Black women in particular. And one of the wonderful opportunities that I've had since I met you, Leisha, is learning more about the Public Health Academy. Can you touch a little bit about your background and the Public Health Academy?
Absolutely. I consider myself to be in this great fraternity slash sorority of health department employees. Normally, those of us who come out of the South, some health department employees will say it don't matter where you are in the country. If you survive and have tenure as a Black health department employee, you got some battle scars to prove it. And it's because of those battle scars that I developed the Black Public Health Academy. You see that where there are low level positions, there is an overrepresentation of Black people in state and county health departments. But as you go up the ladder for decision making positions, the ladder gets lighter and lighter. And so the goal of the Public Health Academy is to support those staff who desire to advance to leadership or executive positions. But there's a skill set that is needed that goes beyond what you get in traditional management 101. Things like, how am I addressing microaggressions? How am I creating my support system for mental health issues as it relates to me being the only Black manager within the infrastructure? What does it look like and feel like for code switching for me? That the way that I get to talk with my dear sister Sharonda might not be the way I need to show up in the executive leadership meeting. And so these are issues that as Black health department employees that other folk may not have to go through. And so what does that look like? The vision also came from something that I'm just really proud of, the coalitions that I've been a part of over the past 2 years for the Prep in Black America Coalition, the Risk to Reasons group, also an initiative from ViiV and the Atlanta Black Women Leaders, that all three of those coalitions have done something that is not unique, but it is necessary when we talk about doing HIV work, and that's support of each other as individuals. And so, what I get to learn from those best practices from the coalition, I'm taking that to the academy to give as tools and resources for Black staff that I'm able to serve within the state and county health departments.
That is so wonderful just to understand and learn all of the things that you've put in place for the Public Health Academy, especially when it comes to Black women in the workforce. And you actually just led into our second question for you. Tell us a little bit about your work projects and initiatives such as Prep in Black America and the ViiV Risk to Reasons campaign, which honestly spurred the CAN Storyteller Series to have an opportunity to talk about Black women and amplify our voices, and why it's so important for projects such as this to be on the forefront.
First off, Grace, can I tell you that I am so excited to be able to talk about, three of my babies. Risk for Reasons has been such an experience that if I never get to be a part of a coalition again, I have been a part of some elite ones, and that is definitely one. To have Black women come together from all over the country and design a project that has had so many spinoffs, such as this one, that we are committed to retiring the word risk. There is nothing about a Black woman's body that's a risk. If you have never heard it before, you are hearing it from me now. Those of us who are living with HIV, those of us who are including prevention strategies so that we prevent HIV, it's nothing about our body that's a risk. So if we eliminate the language, then we begin to educate and train other people to do so. You can help me assess what my sexual health needs are. You know, you can help increase my knowledge so I make informed decisions. But what you're not going to do is tell me that all this is a risk. Nothing about me being a sexy senior citizen is a risk. And I am loving it. And I'm so honored to have served with some amazing Black women of cis experience and of trans experience. And with PrEP in Black America, I really want to take a moment to highlight this coalition. This is one to watch moving forward in 2024. There are 11 amazing community advocates, researchers, clinicians, professors that are doing the work to make sure that as we talk about national PrEP programs and as we talk about what the scale up of PrEP looks like in Black communities, don't speak on our behalf. Allow us to speak for ourselves. And this coalition has released a report for us by us. You can go to the blackpublichealthacademy.com and download the report. And if you were looking for the blueprint for how you address PrEP in your jurisdiction, don't spend no more money on assessments. They've done it for you. Read the report, implement the blueprint, implement the design, and be a part of the solution for us to see the scale up of PrEP within Black communities.
Amazing. And Leisha, you hit the nail on the head. For us, by us. That's opportunities for Black women to really take part in these conversations. And that's exactly what we're doing today. And when it comes to the ViiV Risk to Reasons campaign, you can almost see just in the title, Risk to Reason. Now it's more of a reasoning versus it being a risk and creating that stigma around Black women engaging into care or prevention services. It's now a reason as to why Black women should engage. So I think ViiV has done such a wonderful job at creating that campaign, and you in part of developing that to understand that it's more than just the risk perception. It's more than the risk factors. It's also the reason why Black women should be engaging in care. And I thank you so much for explaining that so thoroughly when it comes to how Black women are impacted, not only by our media campaigns, by the companies that put on these media campaigns, but also how we create initiatives, even in our local health departments. I know that is definitely something that we have also talked about when it comes to increasing those opportunities in our health departments. So thank you so much. So now I'm going to pass it off to Kenja Hassan. Kenja, may you please share your bio and your introduction with us, and then we'll go into the questions that we have for you.
Certainly. I am Kenja Hassan from Arizona State University, and I learned, oh gosh, I would say coming up on a decade ago, I had completely stopped thinking about HIV. It fell off my radar screen. So I grew up in Washington, D.C., understood that our city was part of this major epidemic in the 1980s. And then I moved out here to Phoenix, and it just kind of went away, right? And then about 10 years ago, I realized that that HIV had shifted, and it had shifted to have a stronger impact on Black women. And I saw it happening in my hometown of Washington, D.C., and I saw the disparities here in Arizona. And it was surprising in both cases because I really thought we were done with this big challenge, and because the Black community doesn't talk about it a whole lot. And so I was entering into a PhD program at Arizona State University. I was always interested in understanding the health challenges of Black women. And when I recognized that this particular disparity was still a challenge for us, I decided to focus my research energies in that direction. And a couple of years later, the Fast Track Cities, City of Phoenix signed on to Fast Track Cities. And so I've been able to translate some of my schoolwork into community work at the same time and connect with amazing people in the Phoenix metro area. And so I want to take a point of privilege going off Alicia's introduction to talk about some of the fantastic women who go all out in the Phoenix metro area for people with HIV. Let me mention Hawa Osman, because I saw her in the chat earlier. Angelica Lindsay Ali, Mayasia Pasha, Kalisha White, Arthurine King, Siobhan Woods. Those are just a few. There are many others because, as you know, this is hard work. Some people can stay in it for 20 or 30 years. Some people can only stay in it in 5. And we need to keep passing on the baton. So anybody out there listening in the audience who's in the Phoenix metro area, if you haven't stepped up to the plate yet, we are ready for you to come and pick up that baton and get a whole bunch of love thrown on you and then pass on that baton to someone else. And for those of you who are the long-term advocates, I give my blessings and wrap my arms around you because your work is hard and we appreciate you. And I know you don't get enough love from the larger Black community for all the work that you do.
Oh, that was so amazing, Kendra. And going into the work that you do with Fast Track, our first question for you is, with the institution of Fast Track Cities in Phoenix, how has Fast Track Cities created new programs in the city of Phoenix? And what are contributions and changes that have been made since?
So for listeners who aren't familiar with Fast Track Cities, this is a global United Nations effort to help cities work within their boundaries on dealing with HIV, so that if they're not getting enough attention from their state or federal agencies, then they can really focus energy in amongst themselves. And the city of Phoenix joined in 2016, just a couple years after it started. The city of Phoenix also recently won their Circle of Excellence Award, which was given in Amsterdam just a few months ago. And for me, this has been an amazing process to watch unfold, because what the city of Phoenix was able to do was to have a structured multiple monthly meetings, not just one, but several monthly meetings with organizations who otherwise didn't have the opportunity to talk to each other. So lots of organizations doing work with HIV on the ground, community organizations, state agencies, county agencies, like the Arizona Department of Health Services, the Maricopa County Department of Health, but not necessarily having the structure to be able to talk to each other, and private clinics. And so once people were able to talk to each other, they were able to share large and small experiences, information, put together game plans that weren't possible before. And one of our early successes was helping to create the Arizona Rapid Start program, where we were able to get the linkage to care for the clinics participating in the Rapid Start program. We were able to reduce the linkage to care on average from like 30 days to within 6 days, within the first couple of years of just clinics being able to talk to each other. And then for those clinics participating in the Rapid Start, we were able to reduce viral suppression from 129 days to 37 days. And this was just in the first couple of years. I actually don't have our most current data to share. But some of the other things we were able to do were stigma surveys and reports specifically about our Black and Brown communities. And this was an opportunity for Phoenix medical providers to see what's happening more for Black and Brown people, because what is happening on the ground in our communities sometimes isn't visible because our communities are smaller, especially the African American community. So in the stigma survey overall, we thought what was really striking to us, the ones who participated in the survey, or participated in designing the survey, is that in the Phoenix metro area, across all races, about 70% of people living with HIV still worry about discrimination. About 69% still agree that telling someone about HIV is risky. 68% of our respondents, and we got about 270 respondents for this survey, of all age groups, of all racial backgrounds. And about 68% of them believed that people with HIV are still treated like outcasts. So some of the older stigmas, East Coast cities may have progressed, but Phoenix always seems to be about 10 years behind the rest of the country. And in some ways, when we saw those numbers, we're like, even our beliefs here haven't progressed as quickly as we would have liked. 58% of those people surveyed believed that most people think that a person with HIV is disgusting. So the perception of people with HIV looking at other community and having this sense of, if you knew, you may not like me as much. And so those challenges still reside within folks in the Phoenix metro area. And when it comes to Black women, we did a separate research project just on African Americans. And I'd like to put that in the chat when I'm done speaking and can multitask, because I can't multitask right now. But the link to the City of Phoenix Fast Track Cities page. But one of the striking challenges within the Black community is still concerns with religious teachings about sexuality and sex, and resistance to talking about sex and sexuality. And a lot of folks, we were able to sex and sex behaviors a little bit more comfortably, some of our challenges with HIV would be reduced. In one of our questions, we asked people about how much they would feel like they would have social support if they told their family and friends they were HIV positive. And 52% of the men, and most of the men who were surveyed, identified as gay or same gender loving men. So 52% of them felt like they would get social support if they told friends and family that they were HIV positive. But only 30% of heterosexual Black women said that they felt like they would get social support. So that shows that our women in Phoenix would be more afraid than gay men in Phoenix of letting someone know, and of just feeling like their families and friends would still love and support them. So Grace, I can go on about City of Phoenix.
No, Kendra, that was such an amazing explanation of the work that you've done, not only within Fast Track, but also your research work. And I just wanted to add on, the Fast Track Cities Committee has been the most wonderful program that has been instituted in the city of Phoenix. As a local Phoenix native, we have recently received Phoenix location. And you mentioned Hawa Osman. She is our wonderful program manager in Arizona. And with the Fast Tracks micro funding, she was able to host an event at our local shelter where we were able to have haircuts, dog grooming, as well as food, and also our mobile unit testing services. So the availability of Fast Track in Phoenix to be able to create more opportunities for CAN to go out to the community has been so wonderful. And then on top of that, just sharing the research and data and specific evidence that shows that Black women in particular are really facing a lot of stigma when it comes to disclosing, when it comes to talking about their status. So I just want to thank you for sharing a lot of that. And your second question is, you have done work in understanding Black women's experience with engaging care. Tell us a little bit more about the research that you have conducted, if you'd like to share some more information.
I will. And I want to jump back to something you mentioned about the City of Phoenix, Fast Track Cities micro grants. For any listeners that are part of small organizations, small, medium, or large organizations in the Phoenix metro area, the City of Phoenix Council dedicates a certain amount of dollars every year to the Fast Track Cities Fast Track Cities efforts, so that we can then give smaller grants out to organizations to do the work that they do. So the first many years of Fast Track Cities, there was no money. It was just the staffing that the City of Phoenix allocated. But now they actually do have micro grants available. And there's ways for smaller organizations to get small dollar amounts for anything that helps bring HIV awareness to the community. And so for the organizations that focus on Black and Brown community members, especially our Black women organizations that don't have a ton of money because they're rather small, please go to the City of Phoenix website and fill out the forms. It's pretty quick and simple. So anywhere from $5,000 to $15,000 you can. Thank you, CAN Community Health, for putting that in the chat. So my own research, for my dissertation, I interviewed 23 local providers and 11 women with HIV to understand the best ways that women with HIV navigate the community, navigate the health community here in the Phoenix metro area, and to also understand the relationships with providers and what makes a great relationship from a Black woman's perspective with a local provider. And when I asked that question, both people who were providers and Black women themselves said, well, before we can start with the relationship with the provider, we have to start with our relationship with ourselves. And the women I interviewed were expert navigators of the medical system, right? So they may not have had a whole ton of formal education, but they understood who was going to care for them in the way they felt like they deserved to be cared for as soon as they walked in the room. But each one of them, almost to a T, said, I started with myself. I dealt first with my fears. I took ownership of my own healthcare. I looked for role models. I valued my role in the appointment when I walked into the room with the provider, meaning I knew that the things that I had to ask for were important. And for some of these women, this was like trial and error. For others, this was just self-confidence they may have gained from, somebody who gave them guidance along the way. But I understood what was going on with my body and figured out how to express that and articulate it. And if a person wasn't responding to me in the right way, then I just wouldn't go back. and in some cases, women had providers that they couldn't switch from, and in which cases they would figure out how to make adjustments to those conversations. But that very first internal ownership was key. And when I asked folks who were not living with HIV, what do they observe in women who are very successful in all of the things that they do, from asking for services or getting the resources they need? And they also said the same thing. Those are women who put themselves first, meaning they know they have families, they know they have kids, they know they have other obligations, and they know they can't fulfill those obligations without taking care of their own health. So they don't put themselves on the back burner. And as mentioned before, they've decided that the stigma that I just mentioned in the earlier paragraphs were not going to be a challenge for them. Because it wasn't going to stop them from living the lives that they wanted to live. And on the other side of the coin, providers, now, when they looked at the providers and who were the ones that they would return to, and who were the ones that earned their trust, those were providers. And for those of you who are providers who are listening, I have a whole lot more I can tell you at a different point in time. But they were the ones that gave them straight, clear information, not sweetened, not sugar-coated, but that also demonstrated a complete caring for the woman as a human being. She was not a number. She was not a client. She was not a passing through the door. She was not this random folk who just showed up, asking for handouts. This was a human being who deserved love, caring, and attention. And if that kind of vibe didn't come from the provider, their trust in that provider changed. Now, it may mean that they came back, but they might come back with a whole different agenda, set of questions, and way of dealing with this provider. So for providers, know that your women with HIV who are coming to you, a lot of times they're very well prepared. They may not code switch in the way that you like they may not switch to the Queen or King's English when they're in the room, but it doesn't mean that they don't know the system and how to find resources or how to advocate for themselves. So I'm going to wrap up there. When we have time, I'll come back if possible, but I want to make sure that Ashley and Sharonda have time to speak.
No, thank you, Kenja, for elaborating on the data that you saw with your research that was conducted and talking more about the lens from a provider angle to a patient angle. And here at CAN, we are very patient-centered. So being able to understand our patients when they come into our doors and see how they access services, see how they interpret our services, see how they have questions is so important. And so now I will move on to Ashley. And Ashley, may you please share your bio and introduction with us, and then I will share the questions that we have for you.
Good afternoon. Once again, I am Ashley Kaysen. I am a community advocate, and I'm also a lifetime HIV survivor, and I am the CEO and founder of Her Voice LLC.
Wonderful. And Ashley, can you tell us more about the impact of your work at CAN and ways that you hope to continually serve the community?
So at CAN, I am a program specialist. I am in the prevention department. So I'm actually out in the field bringing awareness to HIV/AIDS, encouraging people to get tested and know their status. But because I'm also living with HIV, in my opinion, I wear multiple hats. So I'm on both sides, the prevention side and the treatment side, because I also do testing in the field and in the clinic as well. So at CAN, I also act as a peer. I'm also sharing any knowledge that I can about treatment, and for especially for those that may be newly diagnosed, because for someone that may be getting tested to find out that they're HIV, it's quite inexperienced. And the most important thing is having someone that they feel like they can relate to and that can support them in the way that they need. So for me, I definitely do that at CAN. I also share my personal story, and I use that to encourage people to get educated and to be knowledgeable about HIV, and also to reduce the stigma in the community, especially in the Black community, because a lot of us still have the wrong idea of what HIV is and how it has affected our community and our peers.
Yes, Ashley, and you are such a wonderful leader and change maker here at CAN. And just knowing more about your work history, can you tell us more about the I Am Work of Art campaign and a little bit more about what you do with your company, Her Voice?
Yeah, so the I Am a Work of Art campaign was actually launched. You can find more information about it on hiv.gov. It is a national campaign that aims to bring awareness to antiretroviral treatment. So, for someone that is living with HIV and they're taking their medication as prescribed, you can reach the undetectable status. So what that means is that the virus is so low in your system that the possibility of you transmitting HIV to someone else is highly unlikely. So the campaign highlights the U equals U concept and encourages people to stay into treatment, to get back into treatment, and it encourages people to get tested as well.
That's so
As far
wonderful.
as far as Her Voice, I founded Her Voice about 2 years ago. I've been speaking publicly about my status for the past 6 years. So through Her Voice, it encourages well, I encourage people to be confident in who you are. It's not so much focused on HIV, but everyone has a personal testimony. And whatever it is that you have experienced in life, whether you want to share that publicly or not, be comfortable in who you are and the things that you have experienced, because at the end of the day your experiences make you the person that you are. Do I like the fact that I have HIV? Not at all. But at the end of the day, my experience living with HIV has shaped me into the person that I am today, and I am able to confidently share my story publicly or privately. So Her Voice is just, it encourages people to to be comfortable in who they are, regardless of what their story is. And if you want to share that, you can, but you do not have to. You live your life to the best that you fully can.
That's wonderful. Thank you, Ashley. That was an amazing answer when it comes to that. And as a mother, I also wanted to ask you the question, can you talk about the connotations and research behind Black women living with HIV and the new findings behind breastfeeding?
So I am a mother of two, and my first son is 3 years old. And when I was going to my OBGYN appointment, the option to breastfeed was not presented to me at that time. Fast forward to now, I actually have a 4-week-old baby that will actually be a month tomorrow that I am breastfeeding. And I appreciate all of the knowledge and research that has came about around women that are living with HIV having the option to breastfeed. And I also want to take the moment to shout out the Well Project and all of the articles and research and things that they have shared, because it is important, especially for Black women, for us to feel that we are supported, because we're always told that we cannot do something, or it's not recommended for us to do certain things. And it's like, regardless of what we have going on, if it's a HIV diagnosis or not, we should be able to do the same thing that everyone else is doing. And let's figure out in what way that we can possibly make that happen. So with breastfeeding, if you are living with HIV and you have the undetectable status, as I mentioned before, it also makes it highly unlikely for you to transmit the virus to your child. So therefore, I'm going to use myself, for example. I am currently undetectable. So the possibility of me passing it through breast milk to my child is highly unlikely. However, as a safety precaution as well, they do have a medication that you can put your child on, and then they also run a series of lab tests just to make sure that the virus is not transferred. And this was not an option that we had years ago. And I want to also take the time to highlight how far that we've come compared to the 1980s and the 1990s, when HIV was on a rise. And unfortunately, it took a lot of lives of people. And fast forward to today, where we still have a lot of us that were diagnosed at that time, or that got the virus around that time. I was born in 1992, and I found out about my status in 2007. And it's by the grace of God that I'm still here. So the medication and the research and the support that we have gotten is so essential in us being in relationships where our partners are negative, or even having the option to breastfeed our child or our children.
Absolutely. And in my time at the health department, there were times where we were engaging new mothers into care, and with their children, they would adapt to the ARV treatment, specifically for children at that time. So just to know the advancement in medication is so important, especially with the changing opportunities that mothers have, is just wonderful to know. And thank you so much for just sharing and elaborating more on your story and the opportunities and information that you'd like to share with us today. And going forward, now it's time for Sharonda to introduce herself. Sharonda, if you don't mind, just sharing your bio and your introduction, please.
Hello again. I am Sharonda Lynn. I am the founder and CEO of Have an Incredible Victory. I was diagnosed with HIV at the age of 19 in 1999. I am now 24 years in, so I'm a long-term survivor. I was listening to Ashley, and she is actually correct. I had two sons after the diagnosis, and I was not able to breastfeed, so that's amazing. My two sons are still negative because I have an undetectable status. So with that, I founded Have an Incredible Victory to come up with innovative ways to educate and bring knowledge to our community in Jacksonville.
Wonderful. Thank you, Sharonda. And our first question for you is, tell us more about the work that you have done with Having Incredible Victory, and tell us about how you founded and created the organization.
Well, again, being that I am HIV positive, my passion and desire has been and will always be to end or have a control over the HIV epidemic in Jacksonville, especially in the Black community, being that we are at a higher risk and the numbers are rising in African American culture. And so, what Having Incredible Victory do, we come up with innovative and creative ways to educate our community, especially the disproportionate people who are impacted, our women who have lack of self-esteem, and with the stigma in Jacksonville is no different than Arizona. We still have a high rate of stigmatizing when it comes to HIV. So when I go out, I speak about HIV and undetectable, untransmittable. I speak about antiretroviral treatment, PrEP. So not only am I encouraging and educating people who's living with HIV like me, I am also educating the negative women in our community, due to the fact that a lot of us, Black women in Jacksonville, do not know that PrEP is for everyone and not just a selective few. So not only am I educating HIV positive women to live out loud, don't worry about what people say. You are still beautiful. And I try to adjust their crown to let them know that no matter what diagnosis you have, my diagnosis is HIV. However, still walk in that mirror, look at yourself in the mirror and say, yes, I am beautiful and I am wonderfully made. And to encourage them to not allow the stigma behind HIV to stop them from who they are, who God has made them to be. And so not only that, I also educate our Black women about PrEP. A lot of our Black women do not know that PrEP is for everyone. So I always tell them, to go and try to get on PrEP. I give them different nonprofit organizations in our community. And so Having Incredible Victory has founded Removing HIV Stigma Parade. Next year will be our third year of going from one side of Jacksonville to the other. And we hold up signs saying undetectable equals untransmittable. Know your status. Don't be ashamed of your status. We've also, we have where it is family friendly. So not only are we educating our Black women, I was told by Alicia, my consultant and my mentor, that if you educate a Black woman, you have educated the nation. And so I really truly believe that, because we are definitely going to get this, the information out to our community, especially our Black women and our youth. And we also do support groups, understanding HIV care, sister to sister, and sisters organizing to survive. I am a firm believer that just because we are women, we all have our different avenues of what we are capable of doing. We are brilliant creatures. We come up with innovative ways, and we can educate and motivate the nation. And so that's what Having Incredible Victory is all about educating our Black community, especially our women of color.
Absolutely. Thank you so much, Sharonda, for elaborating on Having Incredible Victory. I think the relationship that you fostered in our Jacksonville area with the director, Sam Kwiatkowski, over there has been so wonderful. To connect with you and learn more about Having Incredible Victory has been such an amazing experience. So thank you so much for sharing that. And over this past weekend, you have held a play in regards to our next question. So how do you think art and HIV play a role in breaking the stigma behind HIV, and ways we can encourage Black women through media and art to know their status?
Well, again, I've heard several voices on this panel. HIV has a horrific stigma behind it. No one wants to talk about it. No one wants to come up front and say, hey, I'm HIV undetectable. It has a horrible stigma. So I'm like, okay, why don't I put a play together? Well, so we do The Hidden Truth. This is our third year educating the community. The first year, we educated 400 people. The second year, we educated 250 people. And I think last past Saturday, due to the rain, I think we've got about 70 or 75 people that we educated. And so what we do, you come in and you be entertained, because I know Black people, I don't care if you, wherever you are, you love to be entertained. So we entertain with no judgment. And so we do, we also have humor in it. So it's a lot of laughter while getting educated about HIV, undetectable equals untransmittable, antiretroviral treatment, and PrEP. So we do, we educate all different walks of life. So we have our young adults, we educate them. We educate our LGBTQ community and the stigmatizing of our LGBTQ community. We also educate our biracial couple with mental illness in our African American community. We educate our senior citizens, because I think sometimes as we get older, we feel like HIV, we are out of that zone. Well, you know, they're having fun in the nursing homes as well. And so we also educate our religion base. And after we educate, they have to come see the counselor, which is Sharonda Lynn, and they do the business. Because they don't know my status. And so when we talk about it, I stand up and I'll let not only the people that's in the play know the status, I also let the ones that's in the audience know that I'm HIV positive and been HIV positive for 24 years. And I am living my life out loud to help our Jacksonville community. And so it was amazing.
Thank you so much, Sharonda, and just telling us a little bit more about the play that you just hosted this past weekend, your passion and the energy that you have regarding HIV services, linking individuals to care, creating support groups just speaks for itself in the moments that I've met you to today. So it's just wonderful to get to know you and learn about having incredible victory. And now that we've finished off the focus questions, I'd like to open it up to the audience if they have any questions to put it into the chat. A few questions that we had most recently from audience members is the first question that we have is, how do we continually advocate and push for more education in the Black female community? And please feel free, any of the storytellers in the panel, to answer this question.
I just believe as a Black woman can educate another Black woman. We know the struggles. We know what we go through as a daily basis, just being a woman and being a mother. We wear many hats. So I think just to continue the strive, we have to learn that we are not in competition with each other. We want to motivate each other and encourage each other. And so being an advocate, what I try to do is just continue, no matter how hard it gets, because it does get hard, try to continue wearing the hat, showing them that, hey, even though you're HIV positive, you can still live an undetectable lifestyle. You can still live an unapologetically lifestyle. And so I do that with a smile. I do that with love, and I do that with care. And I think as you go through and you're in the community, you have to know that because the subject is so horrific, we have to handle it with care. We can't go in thinking that, oh, because I got it, somebody else. No, we have to handle this with care, especially in the Black community, due to the fact that it's so stigma is really, really intolerant. So I go into the community with care, and also I encourage all our nonprofit communities to join in with us. So just bringing a family-oriented atmosphere, and knowing that they know that they have someone that loves them and care about their well-being.
Absolutely. And with the community health initiative, that was really our angle, is to not only support the community on a testing service side, but also support the community on just a community engagement partnership opportunity to work together to build for more. So I love that you mentioned that, Sharonda, just talking more about partnership and relationship building. Yes. Kenja?
Yeah, I was going to say that we have some incredibly powerful Black women's organizations our sororities, other advocacy groups like the National Coalition of 100 Black Women. And I just want to encourage national leadership of those organizations to maintain this topic on the radar screen. Of course, we have numerous health issues to face, but this is one that we particularly shy away from because it involves conversations around sex. People are doing it. We might as well talk about it. And so our powerful women's organizations, I mean, I think, our vice president, the vice president of the United States definitely credits the power of our Divine Nine and our sororities to get a message across during the 2020 election. We could do that. We can certainly tackle HIV in and among our with our younger women, our generations of younger women, especially, and older women too, because folks do get past that stage where they think they're out of, they're not young and going around having fun all over the place, but it just takes one encounter, right? So yeah, let's have all of our Black women's organizations keep this on the radar screen among the topics that are health related that we should be talking about.
Absolutely. And you just emphasize a certain point with our Divine Nine sororities and fraternities. Those are so important for us to engage with our Delta Sigma Thetas, our Alpha Kappa Alphas. Not only do they have their own health interventions, I believe the AKAs have their own breast cancer mobile unit that goes around to do mammogram screenings, but that's also an opportunity for us to work together to go out with our D9 organizations to support the services dedicated to our Black youth, dedicated to our Black young adults, and then also anyone middle-aged to older to be able to talk more about our services. So that's wonderful. Ashley or Alicia, do you have anything to add to that question?
Yeah, I mean, I think Hinja and Sharonda did such an amazing job in responding to that. But I would also encourage us to not follow media stereotypes of what type of Black woman needs HIV education. As long as we are sexually active, and I'm now looking to leadership. I'm getting my idols that are 70, 80, 90 years old. I'll get a new hip and I'm going to still be running in the race at 90. But I still want to see messaging and images about maintaining my sexual health as a sexy senior citizen. And so I encourage us not to fall in a trap of we only need to educate the youth, or we only need to educate those who are low educated. From PhDs to church mothers and every other category that Black women fall in between, we need to continue to raise awareness about how we manage and maintain our sexual health.
Absolutely. And Leisha, there is a comment in the chat from Lynetta Wilson. She mentioned, I love that you create an opportunity for Black professionals to learn how to elevate their careers within health departments and environments where the top doesn't look like us. She's curious to know, what are some other ways Black women in HIV workforce can elevate each other within our own communities? That's a wonderful question, Lynetta.
Lynetta, thank you for that question. I think that if people had to define my greatest strength or my greatest contribution to the HIV workforce, it would definitely be community organizing or community mobilization. That Leisha has been a resource in that area. And if you believe that, thank you so much. Because my intention was very clear that not one person or one entity can do this work alone and have the impact that Black women need across this country. So then how do we maximize all of this knowledge and expertise and power that we hold, let's be clear that we do bring power into this space. And if the women who you see on this screen, each of us connect the power that we have to each other, we can start moving some things in an extraordinary way that none of us can do individually. And so I've always maintained that focus. And so to women who were saying, I'm not ready to create an academy, but how can I support my sisters? Connect them to resources, connect them to individuals, connect them to people of influence, that they're able to have a much larger territory to carry our message for Black women living with and Black women trying to prevent HIV. You got this. We got this.
Absolutely. That was a wonderful answer, Leisha. Thank you. Ashley, do you have anything to add to that question?
I actually had something to add to the first question. I also just wanted to point out really quickly that sometimes people think that you have to do like a grand gesture or something big in order to support one another or even spread education and knowledge. And really, as long as you're spreading it to one person at a time, you'll be surprised how quickly that knowledge and education get passed on. At CAN Community Health, when I'm testing people, especially young Black women, I always sit down and I talk to them about HIV and STDs and just share any knowledge and education that I have. And there is a lot of them. There is a lot of them that are unaware, they don't know, and their peers or their parents or their guardians, no one is really talking to them about sexual health. Sexual health is not being discussed in the schools. I have even gotten older adults that don't really have a lot of information regarding HIV alone. And sometimes just that one-to-one interaction with you educating them and giving them the information and updated knowledge can break that stigma, and they can share that information with their parents and with their peers and with their siblings and with their schools.
Absolutely. That shared network is so important to be able to talk about these types of things. So that's so important. Thank you, Ashley. And Sharonda, I'm not sure if you had anything else to add to that question.
No, I think they did it all. They summed it up.
And so I'll go into our second question from the
Oh,
comments. What are we? Oh, sorry. Go ahead, Kendra. I'm sorry.
I just wanted to add a question about the education component again. And I wanted to put a call out to all of our providers, all of our medical providers, our OBGYNs, anybody who sees Black women, to practice destigmatizing the conversation about STI testing and HIV testing. And to just maybe, like, from my view, I love the providers, especially the GYNs, that just say, we're going to do a full panel on all of your STI blood work. Is that okay with you? Rather than asking me, do you think you need? Because then I'm like, uh-oh, what does she know about me? Like, oh, what's out there? But if they can just say, we're just going to do this routine testing. It's just part of what I do as a provider to make sure that all of my patients are okay. Then it feels less awkward to get into those sexual health questions with your medical providers.
Absolutely. The amount of women that have talked about the fact that sometimes their provider won't even offer an HIV test because they'll say, oh, you don't need it. That's so important to have continuously throughout your healthcare journey if you go in to see your provider. So that's just a very small anecdote that people don't think about, but that's necessary when it comes to patient care. So thank you, Kendra, for highlighting that. Our last question is, what are ways different organizations can incorporate specialized projects? If anybody would love to answer that question.
The ways that you do it is you just do it, right? I think it's interesting. Let me see how to frame this. That oftentimes when it comes to implementing program designs for women, particularly Black women, we start assessing things differently. We have to get all of these permissions. We got to justify why we need to implement a program that is specific to Black women. Here is our reality in this country when it relates to new HIV diagnoses among women. Black women lead new HIV diagnoses among women. There is your justification. Now that you are aware of it, what will we do about it? And the worst answer is to say that a program was designed that did not include Black women sharing with you what we need in terms of HIV prevention, care, and treatment. I had an experience the past couple of weeks that was very sad for me, that someone that I know and respect within our HIV research community requested a letter of support that I could not write. Because don't tell me that you got a program that's for Black women, but you do not have a Black woman in a decision making position. So nobody who is signing off on this looks like me. Nobody who is getting paid on this research project is a reflection of me. I can't support that. Why? Because there are enough of us in the HIV workforce at this moment that Black women not only need to just be acknowledged, but we need to be paid for the expertise that we bring to the table. And nobody should be funding, endorsing, or supporting programs that are for Black women that you don't have Black women decision makers be a part of.
That is so true.
So true. Sharonda, do you have anything to add to that?
I just, and that's what I definitely agree. As being in Jacksonville is very, very hard. It's like we have to kick down the door to talk about HIV in our community. And then we have to pour out all our energy, but never get paid for it. And so we cannot continue as a Black woman, especially myself, as an HIV positive Black woman who's encouraging and motivating our community and not get paid for it, or not even sit at the table to even make suggestions on the Black community. If you want to change the environment of how people in African American community get tested, know their status, go to their doctor's appointment, you need a Black woman ordering that information. We cannot no longer have somebody that don't look like us sitting at the table and want to try to talk about how we're supposed to get educated. We as Black women we are educated differently, and because we know each other's struggle. I can say something and all of us on this call would know what I say and understand the dynamics. Why? Because we all come from a Black background culture. And so we need more of us sitting at the table when you're talking about implementing projects. You cannot tell me that you understand what I go through when you don't look like me. You cannot tell me that you understand me going through an HIV diagnosis when you don't look like me, because we already have oppression and depression just being Black. Then you think about us in a Black community trying to educate our Black community about HIV. You can't tell me how to get the message across. I can get the message across better than anyone else can in our community. And so even though that, I know a lot of times I'll go to the rougher neighborhood in like Moncrief, Sutel, where don't nobody want to go. Why? Because I understand how to get to that community. And so we have to know that when you're talking about something for our community, you have to have somebody that look like us sitting there at the table and pay us for it. We come with dynamic mindsets. We come with innovative ways to get it out in our community. But don't try to steal what we have to make it yours. It will never succeed because you don't understand our Black community. You can try, but it will fail. Put somebody Black in there with our women, our men, our youth, and watch us make a difference. I've been doing this for just 2020, and I've educated over 1,000 Black women, Black people. Why? Because I know how to get on their level. So when you're needing to motivate or do a special project, put us at the table, not at the end of the table. Don't feed us crumbs. Give us the same dinner that you eat, and let us and just give it to us and watch us manifest it. And guess what? You will still get some accolades behind it. I promise you we will, because we're not selfish. But just put us at the table. Give us contracts like you would do any other culture. Give us contract. Don't manipulate our contract because we're Black. We're Black, but we're definitely educated. And that's how.
Amazing. A seat at the table and having that representation is everything, especially when it comes to these specific projects, when it comes to the initiatives that we're creating at our organizations, when it comes to the opportunities that we have with collaboration with community partners. You hit the nail on the head, and I keep repeating myself with that subject, but you truly have, Leisha and Sharonda, to understand what we're seeing currently today and how we move past that is in particular to having that representation, having that seat at the table. And I just wanted to thank you all again for the wonderful answers and thoughts and ideas that you shared with everybody today. We have so many wonderful comments in the comment section. Someone mentioned that he's proud of what he heard today, and it was very powerful. Another community member mentioned that yes, because we are not going to listen to anybody that has not been through what we're going through. It's important to hear our voices. So I just wanted to thank you all again for your participation today. And in closing, I just wanted to specifically emphasize the importance of why we continue to amplify the voices of Black women regarding HIV services and prevention, and how we continue to push the narrative beyond what we've seen so far when it comes to the HIV continuum with services and care and prevention efforts. It's so important that we continue to have these conversations. And I wanted to thank you all again from the bottom of my heart for being here today. Ashley, Leisha, Kenja, Sharonda, the time that you've spent with me over the past month to put the pieces together and to really have a good conversation has been so wonderful. And again, thank you to ViiV Healthcare. Without ViiV sponsorship and support, we wouldn't be here today. So being able to have campaigns such as the Risk to Reasons campaign, information being shared about ways that we can engage Black women into services and care is so important. And then I also wanted to thank our CAN team and leadership. In particular, Roger Capote, our Chief Communications Officer, entrusting me with this initiative has been so wonderful. Shannon DePalmo, our VP of Community Engagement, Melissa Whitaker, our Senior Director of Prevention Services, our wonderful prevention managers that have taken part and helped me with this initiative, Dan Furby, our Social Media Manager, Brian Gordon, our Director of Creative Services, Jasmine Akins, our Director of Community Relations, John Sapiro, our Director of Special Projects, Joy Moore, our Senior Director of People and Culture, and also, last but not least, our wonderful e-group that has entrusted me with this initiative to build out what we see here today. I am more than grateful for this opportunity to not only speak with you all, to share ideas, to talk about ways that we can encourage the community, but also to implement this internally at CAN. So I just wanted to thank you all again. And if there's any last words that you all wanted to share, I would open the floor to you all.
I would like to say that for all of our allies and potential allies, that Black women strive to be educated and they strive to perform at their best all the time. I'm watching 4 Black women on this screen who are absolutely excellent at what they do. And we are focusing on other Black women out of necessity because we know that they will get left behind if we don't. But what is in the heart of most Black women is love and caring for everybody's kids, for everybody's seniors, for everybody's babies. And so when you make an investment in Black women's education, her career path, like Sharonda said, actually paying women for their knowledge and their work, you might be at this moment getting her support on Black women with HIV in this immediate moment. But in the big picture, you're going to have Black women who are going to put themselves out there and throw down for all the rest of humanity, for all the poor people out there, for all the left behinds out there, for all the folks out there that nobody else will pick up. A Black woman will pick that person up. So your investment as an ally in this is going to have a ripple effect for all of us across the country. So don't be afraid, don't hold back. We're not going to be greedy and selfish with what you give us. And I think these women are examples of that.
Wonderful words, Kenja. Go ahead, Sharonda.
All I want to say is live out loud, Black woman. No matter your HIV status, live out loud. And also adjust another Black woman's crown. We need it.
Absolutely. Leisha, Ashley?
My email signature for 25 years has said, history will record my commitment to stop the spread of HIV. These other women don't have to have it as a part of their email signature. Clearly from the comments that you've heard today, that they take on this same sentiment. And I just want to echo what Ken just said. Let's be clear that there are women in your jurisdiction that they are fighting, they are praying, and they are loving our way out of the HIV epidemic. So continue to support them.
Absolutely. Thank you, Leisha. Ashley?
I would just like to say to all of the Black women that are watching and all of the Black women out there, you are essential, you are important to the culture, you are important to humanity, you are important to society. Do not ever let anyone make you feel different. Do not ever think differently about yourself. Aim and strive for all the beautiful things that you want to do and that you want to accomplish. It doesn't matter to be different. It doesn't matter to stand out. Be confident in that. Be exactly who you are called to be. Live your life to the fullest. Enjoy every single moment of it. Regardless of what you have going on, you are beautifully and creatively made. And always remember that and take that with you wherever you go.
Ashley, those were wonderful words and a perfect opportunity for us closing out today. And Wendell Martin in the chat put, yes, she can. And I think that that is just the wonderful way to wrap up today, because we can, and she definitely can. So thank you all again for joining us today. Storytellers, I appreciate you from the bottom of my heart, and I can't wait to continuously work with you all over the next few months. And thank you all again for joining us today. Have a good day, everybody. Thank you.